Okay, so first we're going to do the medication prep. I'm washing my hands. I would verify the orders with the MAR. Make sure there are no discrepancies between the order and the MAR. You need to determine if the patient has any allergies or any other contraindications and check the MAR. Confirm the correct patient by comparing the name from the order sheet to the MAR. Perform med check label check number 1 for the right drug, right dose, right time, right route. Perform the correct med calculation for all the medications that will be administered. And then make sure you have a nurse double check your calculations to make sure it's right. Go ahead and prepare the medication, and then you're going to recap the needle using the one-hand swoop method. After that, you will do the med label check number 2 for the right drug, right dose, right route, right time, and do not open the meds yet. And first we'll do the sub-Q. So I would introduce myself to the patient. Hi, I'm Shelby. I'm going to be your nurse today, and provide privacy. And then I'm washing my hands. Can you verify your name and date of birth for me? And make sure to confirm allergies and contraindications with the patient. Inform the patient on why they're getting this medication, any side effects they need to be aware of, answer any questions that they have, and then get verbal consent. Before you administer any medication, you want to do a focused physical assessment with vital signs, and then make sure to assess the patient's ability to swallow. Make sure they can swallow pills. Perform med label check number 3. This will be right drug, right dose, right time, right route, right patient. And then I would put on clean gloves. I would inspect the site where you're going to inject, assess it for lesions, trauma, inflammation, and any bony prominences. You need to locate an area with enough subcutaneous tissue and determine the correct angle of the injection, 1 inch away from the umbilicus. And then you will want to cleanse the area with an antimicrobial wipe in a circular motion from the center, and then working out 2 inches from where you're going to inject. And then you're going to grasp the subcutaneous tissue with your non-dominant hand, and you're going to inform the patient that they're going to feel a stick, and you're going to insert the needle quickly using like a dart motion, quickly at a 45 to 90 degree angle, and then you're going to release the grasp on the tissue and stabilize the syringe, and then slowly inject the medication. And then you're going to withdraw the needle at the same angle as you inserted it. Right after, you're going to just apply a cotton ball on there to the injection site with your non-dominant hand. And then you're going to put the cap on the needle and put it in the sharps container. And then you'll just look at the injection site to make sure there's no redness, bleeding, or like an allergic reaction or anything. And then you'll put a Band-Aid on there and return their clothing depending on where you injected. And then for the PO portion, I would take off my gloves, discard, wash my hands. I'd elevate the patient's head to a minimum of 30 degrees. I would put the oral medication in an appropriate container for administration, such as like a little cup. And then you give it to the patient. You need to make sure the patient takes and swallows the medication. Wash your hands. Make sure the bed is in the lowest position, locked, side rails are up, and call light is in reach. And then wash your hands.